for tuning in to today's Life Unites Us webinar on the Pennsylvania Department of Drug and Alcohol Programs. While we are getting settled here, we welcome you to introduce yourself in the chat box by sharing your name, your organization, and why you decided to join us today for this session. We're excited to see who's on the call today, so feel free to use that chat box to introduce yourself. So on the screen now is our agenda for today. This webinar will last about an hour. And to kick things off, a few quick housekeeping items. As a participant on the webinar, you will not be able to speak to the group or share your video, but we'd still love to hear from you. So if you have questions for our presenters, please make sure to add them to the Q&A function, which you'll find right at the bottom of your screen. And we'll save some time at the end to review these questions. We will also be recording the webinar today. We are recording now, and it will be available to view and share after the presentation as well. Today's session is not transferable for CEU credits. However, we can provide a certificate of attendance by request. So just email info@lifeunitesus.org to get your certificate. And lastly, there will be a survey link sent to you at the end of the session. We'd love to have your feedback on this webinar and suggestions for future webinars, so please share your ideas in that survey link. Well, now that all of the housekeeping is settled, we can jump into the session. I would first like to introduce myself. My name is Maddie Morales, and I am part of the team working on the Life Unites Us campaign to reduce stigma around opioid use disorder. I work for the Public Good Projects, a nonprofit public health communications organization dedicated to developing behavior change campaigns. My role on the team is to engage our community organizations in this effort. So I'm especially excited to see so many amazing people on the call already today. We know this work is really worthless without all of you, so we really appreciate you taking the time to be here today. I would also like to quickly introduce the Life Unites Us campaign for anyone that is new to the campaign or wants a little bit of a refresher. Life Unites Us is a project, the Life Unites Us project is a social media campaign developed to reduce stigma around opioid use disorder. And we do this by using a people-forward approach that aims to connect individuals through their stories. So through research and practice in anti-stigma work, we've found that connecting people through stories and similarities can and will reduce stigma. So as you can see on the slide here, we've got sort of a three-part approach here, but our team records stories of community members across Pennsylvania, stories of both personal recovery, but also stories of allyship. We then produce these stories or these short videos on our website and social media to be shared far and wide. Our intent is that by sharing these stories of hope and resiliency, we can prove that recovery is probable, reducing stigma makes recovery more likely, addiction is treatable, those living with an addiction are just like everyone else, and those living with an opioid use disorder are so much more than their disease. The campaign can be found online. So we post all of these stories and stigma fighting messages on our Instagram, Facebook, Twitter, and website. So come find us on social media. We absolutely love when people share our videos and comment, like our posts. We love hearing from the community. And it's because of community partners and followers that these stories get amplified and this work of reducing stigma happens. So here you can see some examples of what the images look like, and you can find the full library of stories on our website. Some really incredible stuff. This project is a partnership between Penn State Harrisburg Pollock Center, Shatterproof, and the Pennsylvania Department of Drug and Alcohol Programs and the Public Good Projects. However, we recognize that in order for this effort to be successful and sustainable, we really need community organizations to join us. So on the slide here, you can see some of the 65 plus partner organizations across Pennsylvania that we are working with on this project, and we welcome you to join us. Some of our partners are on the call today and listed here on the slide, and our aim is to provide a platform for voices from your community and a resource to add to the work many of you are already doing to end stigma. So as a partner, you can join us in ending stigma by amplifying this campaign to your community. And partners of the campaign have the opportunity to help us both recruit those stories and then share them. And you can see some of the other partner opportunities listed out on this slide. And I'd be happy to explain more about that. If you'd like to get in touch, my email is listed there. So feel free to reach out. Without further ado, I'd like to dive into the presentation today and introduce our guests. So on the call today, we have Jordan Lewis, the Policy Director at DDAP, Emily Coleman, the Chief of Staff at DDAP, and Derrick Pelletier, the Director of Intergovernmental Affairs at DDAP. So the three of them are turning on their videos, and I will turn things over to them now to get started with the presentation. So thanks for being here, and welcome to all of our friends from DDAP.
Great, thanks so much, Maddie. I'm going to share our presentation up here now. Good afternoon, everyone. Thanks for spending your lunch hour with us. My name is Jordan Lewis, and I am the Policy Director at the Pennsylvania Department of Drug and Alcohol Programs, or DDAP. I'm here with Kim Coleman, our Chief of Staff, and Derrick Pelletier, our Director of Intergovernmental Affairs. We're so glad you can join us today. We hope that everyone finds this presentation informative and useful. If there's anything you'd like to learn more about, I will be including lots of contact information toward the end. So please feel free to reach out at any time, and we'll be sure to get you what you need. And of course, we're happy to answer any questions at the end of this presentation as well. So we'll be covering three main topics today. The first will be a basic overview of the department, so how we were formed, what our strategic goals are during the last few years of the Wolf administration here, and a taste of our day-to-day operations. We'll also be covering three major initiatives, so how DDAP fits into the Life Unites Us campaign. Kim will be talking about a project we're embarking on called Atlas, and Derrick will be covering our recent Recovery Rising convenings and where we are going from here. And finally, we'll share different ways that you can get in touch with the department, as well as resources for technical assistance. So the image here on this slide is our offices. We are on the 5th floor of Penn Center in Uptown Harrisburg. Most of us have been working from home since March 2020, but starting next week, many of us will be returning at least part-time in the office. So we're hopeful and excited to be dipping our toe back into in-person meetings and a little bit of normalcy again. So an overview of DDAP. Act 63 of 1972 imposed duties on the Department of Health to coordinate SUD prevention and treatment services in the Commonwealth. It also established the Pennsylvania Advisory Council on Drug and Alcohol Abuse, which I'll bring up again later during this presentation. So DDAP started out as the Office of Drug and Alcohol Programs in the Department of Health, then later became a bureau. Act 50 of 2010 then established DDAP as its own standalone cabinet level department. And we officially celebrated our 9th birthday earlier this month, as we have been the single state authority for SUD services since July 1st, 2012. Fun fact, DDAP is one of 2 states with its own dedicated state department for drug and alcohol. The other is the South Carolina Department of Alcohol and Other Drug Abuse Services. If you're familiar with some of the other state agencies in the Commonwealth, you know that we each have our own variation of the keystone symbol. I am biased, but DDAP's is the coolest. Ours is pictured here in blue and red, and it's the image of a phoenix. So if you're familiar with Greek mythology, the phoenix is an immortal bird that regenerates and begins new life from its ashes. So it was fitting that the strategic goals that DDAP formed to plan for our last 4 years of the Wolf administration fell under the acronym RISE. So RISE stands for Reduce Stigma, Intensify Primary Prevention, Strengthen Treatment Systems, and Empower Sustained Recovery. I've included here on this slide a link to DDAP's 4-year state plan where we lay out specific strategies under each of these goals. So please check that out when you have a moment. Basically, all of the work that we do as an agency and all of the new projects and initiatives that we take on harken back to these 4 overarching goals. And it's really our mission as an agency to move the needle in Pennsylvania, along with all of our partners and other state agencies and organizations, to be able to measure our impact in those areas. So I am relatively new to government myself. And one of the first things I learned when I got started was the importance of the org chart. So I will be showing you some org charts to talk through our department's work at a high level. I also like to tell new folks that if you want to learn about the structure of cabinet level agencies, you should look at DDAP's org chart because we have the most basic one out there. So DDAP and the Department of Aging are neck and neck tied for being the smallest cabinet level agency in the Commonwealth, with about 80 employees apiece. Jen Smith is DDAP's secretary. She is the 2nd secretary of the department and was appointed by Governor Tom Wolf in March 2018. At its most basic level, the secretary serves as the most senior advisor to the governor on all issues related to the purview of our department and oversees all policymaking and communications efforts coming out of DDAP. In the office of the secretary, which we call our executive staff, we have one deputy secretary, Ellen D. Domenico. Larger agencies often have multiple deputy secretaries that oversee several bureaus. But for us, Ellen is that person who oversees all 3 of DDAP's bureaus. We have our chief counsel, Dan Fellon, who provides legal counsel to the department. Kim Coleman, who's on our webinar today, is our chief of staff, which is a relatively newer position for DDAP in the last 2 years. But I don't know how we functioned without one because Kim wears many, many different hats for us. We have a special assistant to the secretary, Steve Ross, who was formerly the Luzerne, Wyoming SCA director and provides support to the secretary on several projects. And on the right-hand column in this box, you see 4 positions that all have something in common. So policy director, director of intergovernmental affairs, legislative director, and communications director. These 4 positions, in addition to our chief counsel, all have a dual report to the governor's office. So for example, in my role as policy director, I report directly to both Secretary Smith as well as the Deputy Secretary for Policy in the governor's office, who oversees other health and human service agencies. So as policy director, I'm responsible for working with both the secretary and the governor's office to advance evidence-based policies, particularly those that align with our RISE goals. Derrick is going to go more into depth about his role as Director of Intergovernmental Affairs on the next slide, as he is our stakeholder guru and may certainly be someone you'd like to connect with at some point if you don't already know him yet. Laura Conrad is our legislative director and is responsible for helping the department build and maintain good relationships with our legislators, particularly those with a special interest in drug and alcohol issues. She also alerts us to bills that impact our agency and helps the department coordinate submitting amendments to bills that we might not totally agree with. And finally, Allie Gantz is our communications director. She was previously our digital director. So if you've noticed that our social media presence has really improved over the last few years, that's all thanks to Allie. She really drives the look and feel of the department through our public facing channels, including listservs, press releases, social media, and website, and also supervises our new press secretary.
Hello, everyone. This is Derrick Pelletier, the Director of Intergovernmental Affairs here at the Pennsylvania Department of Drug and Alcohol Programs. In the lead up to developing this webinar, we heard that a lot of there was a lot of interest about this new position. So we thought to take a second to do a little bit of a deeper dive on it, to tell you what I do, what the new position does, and get into some of that. Before taking the job as Director of Intergovernmental Affairs, I was a policy director. I was in Jordan's role, so it was fortunate for me to be able to slide up, and for Jordan to slide up into her policy director role. Jordan used the term dual report, which is a fun way of saying you have many bosses. So not only, as Jordan mentioned, do I report to Secretary Jen Smith, but I also report to Secretary TJ Yablonsky, who leads the Governor's Office of Intergovernmental Affairs. And so that office is a new office. It was started by Governor Wolf in the first term of his administration. Its role is to meet the goal of creating government that works. And so it is an office that seeks to hear from citizens, constituency groups, associations, local governments, and others, so we can listen, learn, address matters, and really work to improve government services for folks. Jordan called me earlier the stakeholder guru. Sometimes I'm also known as the stakeholder guy. My job at the department is to ensure that stakeholder voices are being heard by not only the secretary, but also the office of the governor, and that those voices are being reflected in the decisions that we make about policy, projects, regulations, funding, and that type of thing. And so a large part of what I do is maintain and develop relationships with external stakeholders, specifically with an eye toward meeting our strategic goals and our operational priorities as an agency. So who's a stakeholder? There's a good chance that if you're on this presentation today that you are a stakeholder. It's any person, group, or organization that can place a claim on our agency's resources, attention, or output, or is affected by our agency's output. So some examples I put up there include treatment providers, trade associations, recovery community organizations, lobbyists, advocates, researchers, academia, and consultants, hospital and healthcare systems, insurers, pharmaceutical companies, even information tech firms, kind of all of those entities around the space that that we work in, as well as intergovernmental entities. So I do some intergovernmental work under that title. So state, federal, and local folks. Always happy to meet new people, always happy to hear the ideas, hear the concerns. My email will be provided. I'll drop it in the chat right now, but it'll be provided at the end of this end of this presentation. And so if you want to reach out with a comment, concern, thought, or question, you're more than welcome to. A large part of what I do, I think of as air traffic control. And so I'm often the first person that interacts with people outside of our agency, and I help folks get to the right place within the agency if they have any questions or concerns, and answer a lot of those on my own. So I'll turn it right back to you, Jordan. Thanks.
Thanks, Derrick. So our department actually underwent a reorganization that became official in November. So I'm excited to highlight our new bureau structures here because they make a little more sense now than they used to. Our Bureau for Quality Assurance and Administration's director is Jen Knoll, and there are 3 divisions here. The Division of Budget and Procurement, fairly self-explanatory. They stay quite busy these days with all the special federal funding that we're receiving that I'll touch on a little bit later. The Division of Program Support and Quality Improvement, I want to particularly highlight our new QI section that we're very excited about. Currently, the focus of this bureau has been providing technical assistance on the ASAM alignment process. In the future, this section will also be focused on our medication death and incident review process, a CQI project with IRETA related to improving narcotic treatment program outcomes, and will oversee the peer review process, which is a requirement of the block grant that DDAP receives from SAMHSA. This division also includes training, which I'll get into shortly, and business workflow, which provides support to our employees. And finally, specialty grants, which is also a relatively newer division in DDAP, thanks to the unprecedented federal opioid dollars that we receive now. Our Bureau of County Program Oversight is currently in the process of getting our new bureau director coming soon. In the meantime, we've been in the very capable hands of our two division directors who have had both had long tenures with DDAP. The Division of Program Monitoring provides oversight and monitoring of Pennsylvania's 47 single county authorities, which we'll touch on a bit. They also work with our new QA Bureau to ensure that SCAs are receiving SAMHSA funding that pays for the treatment of uninsured and underinsured clients. The Division of Prevention and Treatment develops standards, policies, and guidelines to support the implementation of evidence-based prevention, treatment, and case management practices for SUD. You may or may not know that DDAP also does this for compulsive and problem gambling. We contract with gambling treatment providers and collaborate with the PA Gaming Control Board on issues related to responsible gambling. And finally, our Bureau of Program Licensure is probably the most well-known and public-facing function of our agency. Our Bureau Director is Jody Skiles, and she oversees the Division of Licensing Operations, which processes incoming licensing applications for treatment facilities, as well as investigates unusual incident reports and complaints. And our Division of Licensing Inspection conducts annual and unannounced inspections to ensure that facilities meet their regulatory requirements. And if any citations are made, they also work with the facility to develop a corrective action plan. We currently license about 800 treatment facilities throughout Pennsylvania. The number of inpatient and outpatient facilities has been relatively steady over the last 4 to 5 years, though capacity has continued to increase, which is encouraging. On the right-hand side of this slide is a screenshot from the licensing page on our website, which includes important links for licensees, including the links to our licensing regulations. Also wanted to note here that the department is currently in the process of promulgating recovery house regulations as required by Act 59 of 2017. Our proposed regulations have been approved by the Office of Attorney General and the legislature and were presented to the Independent Regulatory Review Commission 2 weeks ago. Unfortunately, they were disapproved there. We are currently awaiting their official comments back so we can revise accordingly and resubmit soon. In the meantime, the current draft of our regs is on the Independent Regulatory Review Commission's website. And I'll show contact info towards the end of this presentation as well, if you would like to get on our listserv to receive updates on this process. A Google map of all licensed facilities, including their contact information, can be viewed on the Get Help page on our website. And I'm going to turn it over to Kim to talk a little bit about how DDAP works with our single county authorities.
Good afternoon, and thank you, Jordan. As Jordan mentioned, I'm the Chief of Staff at DDAP. I've actually been with Drug and Alcohol for 20 years, starting out in the Budget and Procurement Unit. And in 2019, I transitioned to Chief of Staff. But first, I'd like to highlight some of the things that the SCAs do. So DDAP is the single state agency for substance use services in Pennsylvania. That affords us the opportunity to seek federal grants from SAMHSA, the Substance Abuse Mental Health Services Administration. And then DDAP contracts with 47 single county authorities that encompass all of the 67 counties in Pennsylvania to perform prevention, treatment, and gambling services. DDAP does not contract with providers directly for DNA treatment services. And some of the SCAs are functional units and perform those services in-house. Others contract with providers directly. And I found that Pennsylvania is a little unique in that we don't contract with providers directly. So we have developed that relationship with the SCAs, and they have oversee those services that are performed in the counties. You can see a lot of the detailed services that the SCAs perform in manuals that are listed on our Department of Health or Department of Drug and Alcohol website under single county authorities. We actually have 4 rather lengthy manuals that describe case management and clinical services, prevention services, as well as fiscal and operational services. In conjunction with those services that the SCAs perform, the additional federal funding that we received over the past couple of years has afforded DDAP the opportunity to issue grant initiative funding applications, which we have done for a number of unique initiatives, such as pregnancy support services, police diversion, recovery support services, opioid prevention in higher education, and employment services. So I know Jordan will talk in more detail about some of the funding, and we'll talk in more detail about some initiatives that DDAP has done over the course of the several years. Thank you, Jordan.
Thanks, Kim. So just to touch a bit further on some of the specific work that our bureaus are doing, our training section is doing some really incredible work coordinating multiple statewide training initiatives and maintaining our web-based application that allows professionals to register for trainings throughout the Commonwealth. Currently, we have a number of in-person, virtual, and on-demand training options available on a variety of topics, such as treatment prevention of gambling. So a sample of those topics are listed on those slides. They include Addictions 101, screening and assessment, motivational interviewing, case management skills. Under prevention, we have Prevention 101, ethics, and under gambling, for example, there is an International Certified Gambling Counselor certification available, gambling and ethics, online gambling, and other topics. Some additional trainings include cognitive behavioral therapy, trauma-informed care, medication-assisted treatment, cultural competency, conflict management, communication skills, staff burnout, criminal justice, pharmacology, and a variety of other topics. Right now, the only course that DDAP charges for is clinical supervision, but any other course that DDAP hosts is free. If an SCA is hosting a training, it's possible they may charge a nominal registration fee, usually less than $20, particularly if they provide lunch or have or CE credits or have other overhead like room rental or utilities. So to see what's available, you can access the training management system through DDAP's website in the top right tab. You just need to set up a free account first before registering for the trainings. As I mentioned, grants management has been a major function of our department over the last few years. For a long time, we've received the Substance Abuse Prevention and Treatment Block Grant from SAMHSA, which largely provides treatment funding for un- and underinsured clients in Pennsylvania. In response to COVID, SAMHSA also distributed over $4 billion in funding from the COVID Relief Act, of which DDAP received $55 million. And since 2018, we've also seen a pretty unprecedented influx in opioid funding through the opioid response, the state opioid response or SOAR grants. The first 2 years was $55 million a year, and the second 2 years is currently $79 million a year. So yes, quite a large amount. That's about $1 million per DDAP employee for our agency to be managing. But the beauty of that is that it's allowed our agency to do some really creative and innovative partnering to get these dollars out the door to the community, to organizations doing some really progressive work, and to our sister agencies in the Commonwealth. So I've included a screenshot of our funding opportunities webpage where we post these grants that we offer. And I will also highlight some of these projects on the next slide. Some upcoming money that we're also expecting is the American Rescue Plan funding, which should be arriving in September. The spending plan is currently under review, and some opioid settlement funds. So McKinsey money is awaiting appropriation from the General Assembly, and there are additional settlement dollars that we're also awaiting further details about. So to highlight a handful of projects that we've been able to support with SOAR funds, we've distributed around $20 million to more than 50 organizations at this point. Some of these projects include community recovery support services. So that included grantees that could deliver recovery coaching through CRSs, education and employment supports, life skills support groups, and delivery of substance-free social activities. We've also delivered some grant funding for employment support services. I'm excited to share that this will be the topic of our August webinar, and we'll be highlighting some of our grantees in that panel discussion. So these grantees are able to provide resume writing, interviewing skills, job placement, and transportation assistance related to employment for individuals in recovery. And an important component of this grant as well was that grantees must identify at least one employer partner who was committed to providing employment opportunities for the individuals being helped by these services. We've awarded grants for family and recovery support services. So this could include recovery coaching through CRSs and CFRSs, life skills support groups, family support, and other types of services, and pregnancy support services. So our third iteration of this funding opportunity just closed a couple weeks ago, and these include support services for pregnant and postpartum women with substance use disorder. Another important initiative, DDAP contracts with a behavioral health helpline administrator to administer the Get Help Now hotline for Pennsylvanians at 1-800-662-HELP, which is the same number as the SAMHSA helpline. There's also a live chat option and a text message option available for those that don't wish to call. The helpline is free, confidential, always staffed. Trained staff assess callers to determine their needs and provide warm line connections to treatment or recovery services, as well as provides general information as needed. It's available in 240 languages. And on this slide, we've linked to an e-toolkit on DDAP's website, which contains printable cards and posters with our Get Help Now hotline information that you can distribute. It also includes assets from our media campaigns about the hotline. So please feel free to check that out. The Get Help Now section of our website also has a zip code and county search tool, so you can look for SUD or gambling treatment, as well as the location and contact information of your SCA. And Kim will soon be talking about a project that will expand the functionality and usability when it comes to searching for treatment in Pennsylvania. So to touch on some current DDAP initiatives, the Life Unites Us project is one of the projects that is funded by a chunk of our SOAR dollars. It directly aligns with one of our RISE goals of reducing stigma. And we are so proud to be partnering with the Public Good Projects, Penn State Harrisburg Pollock Center, and Shatterproof to collaborate on this really far-reaching evidence-based stigma reduction campaign. So please do check out lifeunitesus.com and follow the campaign on social media if you're not already. We will be continuing to fund this effort over the next 2 years as well. So keep an eye out as it continues to blossom and expand. We're very excited to see where it goes and to continue measuring the impact that it's having in Pennsylvania. And I'll pass it over to Kim to talk a bit about Atlas.
Yes, thank you, Jordan. this additional funding has really afforded us opportunity to do things that we have not been able to do in a number of years. This Atlas is an addiction treatment locator assessment and standards platform. It is a free web-based platform, and it's already in use in Delaware, Louisiana, Massachusetts, New York, North Carolina, and Virginia. Pennsylvania will be added in April of 2022. And I know Shatterproof is in conversations with other states, I believe California and possibly for Florida, to add them also to this platform. This platform helps individuals and their loved ones find treatment in their area. It's done by clicking on the Take Assessment, and it's a 13-question quick assessment that identifies the risk and severity in each of the 6 ASAM dimensions. And this is not a tool that replaces any in-person intake or evaluation that is done when someone actually goes to a facility to seek treatment. But it does allow individuals to make informed decisions about their care. Once the resources are populated, you can filter it by location, insurance, services. In Pennsylvania, we've actually begun providing demonstrations to our single county authorities, to providers. We started our advisory committee in July of this year, and we're already talking about what kind of resources that we would add to the site for Pennsylvania's needs. Shatterproof has been very receptive to making modifications. I think one of those modifications, as I mentioned, I think Pennsylvania's unique in the relationship that we have with direct contract with our single county authorities. And we've had many people on our advisory committee, as well as the demos, that have talked about how we can incorporate additional resources available on this website. Another good thing is that Pennsylvania uses the same contractor, which is First Choice, for the Get Help Now, and they're already utilizing this platform to assist individuals find treatment. So this is an exciting opportunity. We will be sending out surveys to providers in the fall, around October of 2021 through January. And through those surveys, they'll provide information about their facilities that will be vetted through both Shatterproof and DDAP, so that it can be incorporated into the website, with a launch for Pennsylvania being around April of 2022. So look forward to that being another tool in the toolbox for everyone.
Thanks, Kim. And now I'm going to turn it over to Derrick to talk about our recent Recovery Rising initiative.
Hello again, everyone. So the Secretary, in looking at the support services in Pennsylvania, certainly recognizes that recovery as a service has been chronically underfunded, not only within the Commonwealth, but across the nation. And the dollars that are coming in that Jordan talked about earlier provide us with a real opportunity to support these services and to infuse some additional strength into the overall system. If you think about prevention, treatment, and recovery, out of those three, recovery has probably been the least funded. And so in order to kick this off, we felt an engagement with our stakeholders in the recovery community was particularly important, to hear about what services that they offer, but more importantly, what recommendations that they have to this idea of fostering a resilient, diverse, and accessible recovery environment in the state. And so earlier this year, between April and June, we held 4 regional meetings to solicit those recommendations, and those meetings ended in a statewide convening. And the whole goal of that was to develop a framework for change. And all of these stakeholders can feed into, and so a guide for moving forward. If you see the next slide, you can see some of the groups that attended those those events. So we had 181 individuals. As often as possible, we tried to play to a rule for one individual per organization. And so we had almost the same number of organizations around the state. We had members of the assembly in attendance. We had local governments. We had certainly the recovery community, recovery families, housing and homeless services, the justice system. And what we ended with after 4 regional meetings was 33 pages of recommendations. And if you see our next slide, those recommendations are currently being narrowed down to build that framework that I discussed earlier by our advisory commission team. You might see that some of those folks on that are listed on that team are on today's webinar. So hello if you're here. But this team will help us moving forward, take those 33 pages and really narrow them down into both short-term and long-term objectives, things that we can finish before the administration ends, and things that we will be giving to the next administration as targets to work on. So looking forward to the future on this. This work group has been extremely helpful. The conversations have been very frank and honest, and very happy to be part of kind of this stakeholder-led initiative. Thank you, Jordan.
Thanks, Derrick. So there's so much that we haven't covered in this webinar. I do invite you to poke around on our website to learn more about what we do, including our prescription drug take-back program, some of our naloxone efforts, our collaborations with our sister agencies, and the 3rd annual psychostimulant symposium that we're planning for December. So the URL to our website is here. And this is a screenshot of the Contact Us page on our website, which includes phone numbers and email addresses for basically all of our different programs that folks tend to have questions about most commonly. I wanted to specifically point out our mainline number listed there, and the email addresses for the press office to get on our listserv, and the Recovery House listserv toward the bottom to get updates on the Recovery House regulations. So again, this is just a screenshot from the Contact Us page on our website. I also wanted to invite you to participate in our bi-monthly advisory council meetings. As I mentioned in the beginning, Act 63 established the Pennsylvania Advisory Council on Drug and Alcohol Abuse, which is composed of the Secretary, Secretary Smith, and 7 council members appointed by the governor. Meetings are held bi-monthly. They are typically Thursdays from 1 to 3 p.m. And our next meeting is August 19th. It's actually our annual joint meeting with our parent panel advisory council. The public is invited to call in. We're hopeful that August's meeting might also have an in-person option. So for information on how to attend or to get a Microsoft Teams link to join virtually, our executive assistant, Mary Jones's email is listed here at mjones1@pa.gov. September is Recovery Month. This year's national theme is Recovery is for everyone, every person, every family, every community. If you have an event that you're planning, please reach out to our press office if you'd like it listed on the statewide event calendar that we're developing on our website. DDAP is also hosting a Twitter chat on Tuesday, September 14th at 2 p.m. So some additional participant info will be coming out on that if you'd like to see what questions are coming and prepare some responses in advance. I know many folks are interested in hearing about technical assistance opportunities. So in addition to anything that DDAP may be able to offer folks, SAMHSA has a training and technical assistance page that's linked here. The Addiction Technology Transfer Center Network, or ATTC network, was also established by SAMHSA in 1993 and includes 10 centers that serve all 50 states and US territories. So Pennsylvania is part of the Region 3 Central East ATTC, which is managed by the Dania Institute. And they provide evidence-based training, leadership, and organizational development, and foster collaboration between practitioners, researchers, policymakers, and the recovery community. So please check out that link if you'd like to learn more, if interested. As Derrick had mentioned, with some of our Recovery Rising work, the Opioid Response Network was involved. ORN was created through a SAMHSA grant to the American Academy of Psychiatry. They were originally created to support states and territories that receive SAMHSA grant funding, but they are open to TA requests from other entities as well. So you can submit a TA request form on their website. And finally, I also included a link to a SAMHSA publication about how to develop a competitive grant application that may be helpful to some folks who have an interest in applying for outside funding for your organization. So thank you so much for your time and attention today. Kim, Derrick, and my emails are listed here. I've also linked to DDAP's Facebook and Twitter pages, as well as the email address to get on our listserv. Again, we hope this was helpful and informative. We're happy to take any questions now, or please reach out to us down the road if anything comes up. And thank you.
Thank you so much. That was a very informative presentation. I certainly learned a lot, appreciated all of those diagrams and information. We did have a couple of questions that came in. For the rest of you on the call, feel free to continue to share those. So the first question, does DDAP have the designation for being a recovery-friendly workplace?
We don't have that designation. I have seen that a couple other states have moved in that direction. A couple states have deemed, set up a program to deem some workplaces as being recovery friendly. We do not do that yet.
I would add, Jordan, DDAP certainly considers itself to be a recovery-friendly workplace, and we certainly employ a number of individuals who are in recovery themselves. There was the Recovery-Friendly Workplace initiative in 2014 through funding with PCCD. We were behind those dollars, and so I suspect that the reason why we might have not applied for that designation was that we were the ones funding it, but I'm happy to look into that a little bit more. But that said, we certainly consider ourselves to be a recovery-friendly workplace.
That's great. And I will also take this moment to plug our upcoming webinar in August is about recovery-friendly workplaces. So I'm just going to drop the link to the registration for that webinar coming up in August, and there will definitely be more conversation about that coming soon. The next question I have for you, and I'm also seeing a bunch of questions about the slides and the recording. This will be recorded and the slides will be shared via an email to everyone that has registered today. So don't worry, you'll have this information to reference later on. Another question we have here is, will the family grant that you had mentioned, will that be coming back out again?
That's a great question. I am not aware of any specific grant opportunities that we have coming out for the remainder of the year, but I mean, with all this funding coming in, we will certainly have many additional opportunities for community organizations and others to apply to DDAP for funding. So the family grant one, I can't specifically answer, but there will certainly be opportunities for grants coming in the future.
And if individuals are added to our listserv, they would get the announcement for any initiatives posted on our webpage under funding opportunities.
Oh, great. Definitely a good thing to check out.
But also add, before we move on, as part of
Sure.
our Recovery Rising initiative, conversations about family support services were key to the recommendations that came through, and it's very likely that those recommendations would be contained in that framework that we would ultimately provide some additional support to. So I think we're moving in a direction that the question asker would appreciate.
Awesome. All right, next question we have here is, are the funding and grant opportunities available for nonprofits to apply for, or is it only for SCAs to apply for?
The funding opportunities on our website are actually for other entities other than the SCAs. The SCAs have a different procurement mechanism that we utilize, which is we have direct 5-year contracts with them, and any amendments or funding initiatives would be done separately. So all of the funding opportunities on our website are for other entities other than SCAs.
Got it.
Also make a plug for our listserv, Kim. We always announce them through our listserv, and we often use our social media to promote them. So that's another good reason to get connected to those resources. You will be able to see funding opportunities as they roll out.
That's great. So much good stuff happening on social media. That's great to hear. Okay, so another question here, someone a bit frustrated about hearing about all of the new funding that's coming out and wondering why existing MAT providers that provide services for publicly funded individuals have not experienced any increase in rates of funding from these opioid dollars. So I guess that's a question about existing MAT centers, why they're not getting more money than previously.
I'm happy to field this one as well. The rates conversation is a little complicated, so bear with me on this one. So we fund entities through the single county authorities, and those rates are often referred to as the XYZ rates. Don't ask me how it got this name. That's just the name that they're called. But many counties have increased those rates, in particular in relation to adjustments related to ASAM alignment. So the state has undergone a process to align itself with American Society of Addiction medicine criteria. Often when folks talk about rates, what they're talking about are the rates that are that come through the managed care organizations, the MCOs, which are specifically Medicaid funded. And those rates and that relationship is, and the Medicaid dollars are controlled by a different agency, the Department of Human Services. That said, the Secretary certainly recognizes that during COVID, providers are indeed struggling, and the system has been underfunded for a long period of time, and our department has engaged in conversations with DHS, with MCOs, and happy to say that some MCOs are increasing the rates. So, for example, Perform Care has recently increased its ambulatory rates by 7.5%. So that would hit some of those MAT providers. Other MCOs like Beacon have committed to increasing their rates as well, mostly related to that ASAM alignment. And so it's certainly an issue that we're looking at and we continue to work on. We've made some progress, but certainly more progress needs to be made. In addition, some of the funding that Jordan spoke to earlier, we're looking at what we're calling provider stabilization payments. And so ways that we could use that funding to support providers that have experienced difficulties due to COVID, difficulties due to their census, dropping for a little bit and then coming back, difficulties related to finding staff. So we're looking at ways to provide supports on that level and hope to have more announcements later on.
Yeah, and I'd also like to add too that a lot of these federal funding that we are talking about often come with restrictions and requirements. So we have to work within the confines of those funding restrictions and requirements, as well as the Commonwealth. We have specific procurement requirements that we have to follow as well. So a lot of times we're working through a lot of those difficulties of processes, and so it doesn't mean those conversations aren't happening. It just means we have to work through the details sometimes.
That's a really good point, Kim. And so some of the opportunities that are coming our way for funding are one-time opportunities. And so when you think about rates, you think about structural ongoing support. And certainly we have been lobbying the federal government for the need for ongoing funding, not one-time funding. It makes our life a whole lot easier in terms of supporting not only the system, but supporting a chronic lifelong disease.
Got it. Thank you. Another question, are there any specific policies DDAP is advocating for or wants to implement at the state level that you all want to highlight or recommend people support and look into?
I'd certainly like to put in a plug for Atlas at this point. It's a program that we feel like will be really worthwhile once we get all the information and data into the system, especially with incorporating what other states are doing. So it's not something that we're going to mandate providers to do, but we strongly encourage them to participate. And I'm the coordinator for Atlas for our department. So any additional questions or feedback, if someone wants to send me an email about that, I'd be happy to, provide any information that I can.
I would also add in terms of specific policies, and this has been largely spearheaded by the Department of Health with DDAP supporting and working to garner support as well, but the legislation for syringe service programs. So Roseanne Scotty from Department of Health has been going up and down and across the state of Pennsylvania, garnering support for some of the syringe service program legislation that's out there. And at this point, over 100 organizations have publicly declared their support for that legislation. So that's a specific example of a policy that that DDAP is looking to advance as well.
Great, thanks for that. Another question, I think we have time for another one here. Can non-DDAP licensed programs such as SUD treatment embedded in primary care apply to funding announcements released by DDAP?
Yes, and some of our grantees for the pregnancy support service grant opportunity, for example, fall under that category.
Okay, great. One more here. What suggestions can you share for those of us who are running into obstacles hiring only licensed or certified individuals under the new requirements under the ASAM alignment, which took effect on July 1st, particularly when reimbursement rates and funding have not increased?
So I would recommend to that individual that you reach out to us. You're welcome to email me directly with my email up on the screen there. There's also an ASAM resource account. I'm not sure, Jordan, was that on the slides as well? So one of the things that we're finding is that there are a number of areas in which providers have over-interpreted the ASAM alignment requirements, as well as areas where DDAP has provided flexibility that providers don't have 100% understanding on how to take advantage of that flexibility. And so reach out to us, tell us you're having issues, and open up that dialogue. Specifically, where, which level of care are you having the issues, and we'll have the conversation. So please reach out.
Great, thank you so much. And we're right about at 1 o'clock here. I'm gonna put in the survey link one more time for everyone into the chat box. And I really just wanted to take this last minute to thank everyone for joining us today. Thank you again to our presenters. That was a really fantastic and informative conversation we just had here. So we'll look forward to continuing the conversation. I think there's probably still a lot of questions out there, but thanks again to everybody who was able to join us, and we hope you are able to join us for a future webinar. So thanks so much.